AHS began vaccinating older seniors in group living settings, in addition to the continuing care facilities that were in our first priority. Today, we opened eligibility to all seniors who are 75 and older. And as of, just moments ago, when I last was briefed on this, we had over 25,000 appointments that had been booked so far today. And the first shots booked this morning are getting done this afternoon. As the next step, I'm thrilled to announce today that COVID-19 vaccines for Albertans 75 and older will begin to be offered at community pharmacies in the first week of March. Participating pharmacies will begin scheduling appointments today for the time slots that they have available, and this will make it easier for seniors to get their dose as quickly as possible. Now, to start off with, due to limited supply and logistics required, the vaccine will be limited to participating pharmacies, as I said, in Edmonton and Red Deer and Calgary. And we know that many pharmacies across the province are keen to jump in and assist in this immunization program. However, we must start small due to the limited vaccine qualities that were being provided by the federal government and the strict storage and handling requirements for the Pfizer vaccine. The ministry has selected the first pharmacies based on geography, as well as on population needs, as well as their demonstrated ability to handle large volumes of immunizations in short timeframes. Considerations for things like physical distancing and infection prevention and control processes are also critical. And in this first stage, we anticipate there will be a total of 102 pharmacy partners in Edmonton and Calgary, and as I said, Red Deer, to help immunize the large number of folks who are 75 and over. And I want to reassure those eligible Albertans not in or near one of these centers that they will still be able to receive their doses of the same time frame, close to home through AHS. What I'd like to see going forward from AHS is ensuring that the work with TELUS continues to make sure that there are no busy signals, that they continue to make sure. And look, we actually said weeks ago, and actually we've said it throughout the pandemic, that when it comes to responding to the pandemic, that money is not an issue. Resources are not an issue for AHS. And we actually did check in with them a few weeks ago to make sure that they were ready. They advised us that they were. So we're disappointed, like all Albertans. What I'd like to make sure is that AHS, knowing that money is not an issue, that we want to provide them with any resources that they need, that they come to us, we're making sure that they are deploying those resources in a way that ensures that there are not going to be delays. Now, we do have 25,000 people booking appointments. The difficulty is not necessarily in the booking of appointments, although people can be frustrated in not being able to get that appointment right away. That's not stopping us from getting the vaccine into people's arms. And there are appointments that are made this morning where people are already getting the vaccine this afternoon. And we do have the capacity, as I said, to do 5,000 appointments per hour. I think that once we do have those appointments booked, I think that's going to help with some of the anxiety and frustration that people have. But as you asked the question, and as I said, the priority 2 groupings for phase 2 are also going to be staggered in different age groups as well.